If you're taking omeprazole for acid reflux, you're not alone. Millions of people depend on it every day to feel comfortable and avoid that burning sensation in the chest. It works fast, and for many, it feels like a lifesaver. But what if this common medicine is not as safe as it seems when used for a long time? The problem is not the short-term use. The real concern begins when people continue taking it for months or even years without fully understanding the risks. Over time, lowering stomach acid can interfere with how your body functions, leading to problems that are often overlooked or misdiagnosed. In this video, we are going to reveal 6 hidden dangers of omeprazole that are often ignored or not explained in detail. This is information that can help you stay aware, ask the right questions, and protect your health before small issues turn into bigger problems. Omeprazole is one of the most commonly used medicines for acid reflux and heartburn. It works by reducing stomach acid to give quick relief. But when used for a long time, it may lead to serious hidden problems. In this video, we'll break down 6 dangers you should never ignore. Danger, #1 Vitamin B12 deficiency. Your body needs stomach acid to absorb vitamin B12 properly. It is not just about digestion, it goes much deeper than that. When omeprazole is taken for a long time, it keeps reducing that acid day after day, and slowly, your body begins absorbing less and less B12. You won't notice it right away. That is what makes it so concerning. Months pass, sometimes even years. And then, the symptoms begin to appear, quietly and gradually. You feel tired all the time. Your energy drops for no clear reason. Simple tasks start to feel harder than they should. As the deficiency grows, it can affect your nervous system. Some people experience tingling or numbness in their hands and feet. Others notice memory problems or difficulty concentrating. In more serious cases, nerve damage can develop that takes a long time to recover from. The most troubling part is that almost no one connects these symptoms to their acid reflux medicine. They blame stress. They blame aging. They go through tests looking for answers. But the real cause has been quietly building inside them the whole time. Danger, #2 Low magnesium levels. Magnesium is a nutrient your body depends on every single day. It supports your muscles, your heart, and your nervous system. But long-term use of omeprazole can slowly lower magnesium levels without any clear warning signs. It doesn't happen overnight, it builds silently. At first, you may notice small things like muscle cramps or unusual weakness. Then it can progress further. Some people develop irregular heartbeats, which can become dangerous if ignored. In rare but serious cases, it can even lead to seizures. The most concerning part is that most people never get their magnesium levels checked. So the deficiency keeps growing quietly. By the time symptoms become obvious, the body is already struggling, and the connection to the medicine is almost always missed. Danger, #3 Weakening bones. A&D fracture risk. Strong bones depend on proper calcium absorption. And for calcium to absorb correctly, your body needs stomach acid. When omeprazole keeps acid levels low for a long time, calcium absorption begins to suffer. Slowly, your bones start to weaken. There is no pain at first, no early warning, but the risk builds quietly in the background. This is especially dangerous for older adults, where even a minor fall can cause serious fractures in the hip, wrist, or spine. These injuries take a long time to heal and can permanently affect mobility. What makes this even more alarming is that most people never connect their weakening bones to a medicine they take daily for acid reflux. Danger, #4 Kidney damage. Your kidneys work silently every day, filtering waste and keeping your body balanced. But long-term use of omeprazole has been linked to kidney problems that develop just as quietly. It often begins as inflammation inside the kidneys. No pain, no obvious symptoms. Over time, this inflammation can progress into chronic kidney disease, a condition that may affect you permanently. Many people only discover the problem when routine blood tests show abnormal results, and by then, some damage may already be done. What makes this particularly dangerous is that people rarely connect kidney issues to a medicine taken for acid reflux. The link feels unrelated, but it exists, and ignoring it can lead to consequences that are very difficult to reverse. Danger #5. Increased risk of gut infections. Stomach acid does more than digest food. It acts as a natural defense, destroying harmful bacteria before they can cause problems. But when omeprazole reduces that acid, this protective barrier weakens. Without enough acid, bacteria that would normally be killed can survive and grow inside the gut. This increases the risk of infections that cause symptoms like diarrhea, stomach pain, and fever. Some of these infections can become severe if left untreated. Most people blame something they ate. They never realize that their body's natural defense has been quietly compromised by the very medicine meant to help them. And once that barrier is down, the body becomes far more vulnerable to infections that could have been avoided. Danger #6. Rebound acid and dependency cycle. This is one of the most frustrating effects of long-term omeprazole use. When someone tries to stop the medicine suddenly, the stomach reacts by producing even more acid than before. This is called rebound acid hypersecretion. The burning sensation returns, often stronger than the original problem. The discomfort feels worse than ever, so naturally, the person goes back to the medicine, believing they still need it. But this is not the original condition returning. It is the body reacting to the sudden withdrawal. This creates a cycle that is very difficult to break. You stop, symptoms come back harder, and you start again. Over time, people feel completely dependent on the medicine without understanding why. Breaking this cycle requires proper medical guidance, but most people are never told this effect even exists. Danger #1. Vitamin B12 deficiency. Your body needs stomach acid to absorb vitamin B12 properly. It is not just about digestion, it goes much deeper than that. When omeprazole is taken for a long time, it keeps reducing that acid day after day. And slowly, your body begins absorbing less and less B12. You won't notice it right away. That is what makes it so concerning. Months pass, sometimes even years, and then the symptoms begin to appear, quietly and gradually. You feel tired all the time. Your energy drops for no clear reason. Simple tasks start to feel harder than they should. As the deficiency grows, it can affect your nervous system. Some people experience tingling or numbness in their hands and feet. Others notice memory problems or difficulty concentrating. In more serious cases, nerve damage can develop that takes a long time to recover from. The most troubling part is that almost no one connects these symptoms to their acid reflux medicine. They blame stress. They blame aging. They go through tests looking for answers. But the real cause has been quietly building inside them the whole time. If you are currently taking omeprazole, the most important thing is this: do not panic, but do not ignore what you have just learned either. The biggest mistake people make is stopping the medicine suddenly. As we discussed, that can trigger rebound acid and make everything worse. Instead, speak with your doctor before making any changes. A proper plan to gradually reduce the dose is always safer than stopping on your own. Focus on using the lowest dose that actually works for your situation. More is not always better. Your body only needs what it truly requires, nothing extra. And remember, medication is not the only answer. Simple lifestyle changes can be just as powerful over time. Pay attention to what you eat. Avoid foods that regularly trigger your symptoms. Maintain a healthy weight. These small, consistent changes can reduce how much you depend on medication and protect your body in ways a pill simply cannot. Omeprazole can be genuinely helpful when used correctly and for the right amount of time. But as you have seen today, long-term use comes with real risks that are rarely explained clearly. This video was not meant to create fear, it was meant to give you awareness. Because when you understand what is happening inside your body, you are in a much stronger position to make safe and informed decisions. If this video helped you, please share it with someone who takes acid reflux medicine without knowing these risks. It could make a real difference for them. And if you want more honest, clear, and important health information like this, subscribe and stay connected. Your health deserves that attention.